There is no doubt that bioidentical testosterone has become increasingly popular over the course of the last generation. There are millions upon millions of aging males that have turned to low-T therapy from reputable hormone clinics in order to treat andropause, also known as age-related testosterone deficiency. Testosterone creams, patches, and injections have shown to be highly capable of boosting testosterone levels back to normal and restoring sex drive and energy for men suffering from hypogonadism. But there has always been the question of drawbacks. What is the potential downside of testosterone? Historically, the lack of longitudinal studies has impaired our knowledge regarding what the risks of testosterone therapy truly are. But a growing number of studies released over the course of the last few years have quickly changed what we know about testosterone. Studies nearer to the turn of the century seem to suggest that there may be a correlation between cardiovascular disease and testosterone therapy, and this necessitated further study to truly recognize the safety concerns related to low-T treatment with therapeutic testosterone. Fortunately for men with testosterone deficiency interested in hormone therapy, these studies have not been corroborated, and issues with the research methods inflated cardiovascular risks associated with testosterone. There are multiple factors which contribute to this misunderstanding about testosterone. For example, in some of these studies, patients were given way more testosterone than they actually needed. Appropriate low-T therapy dosing boosts testosterone to normalized levels, whereas many patients were receiving testosterone far above that which is normally produced by a normal and healthy male. When men have too much testosterone in their systems, this truly can lead to cardiovascular complications. But new research suggests that restorative testosterone therapy prescribed appropriately by a hormone specialist can improve cardiovascular outcomes for patients, the opposite of what earlier researchers concluded. Another issue which led to testosterone misconceptions was that the patients that were examined were not appropriately screened for other health issues, which affected their cardiovascular and mortality risk. Patient data analyzed did not take into account the negative influence of these comorbid disorders on the health of the patient, making it appear that the risks of testosterone therapy were greater than they were in reality. One of the most recent major studies regarding testosterone safety was released by the American Heart Association in 2015. In this study, researchers followed more than 1,400 men ranging in age from 52 to 63 that had healthy hearts in combination with low-T. What they discovered was that testosterone replacement for low-T had no negative impact upon risk for death, stroke, or heart attack. Another study, released in the same year by the Mayo Clinic, examined the medical history of 30,000 patients taking testosterone with regard to the risk for blood clots. They found no evidence that testosterone replacement therapy increased the risk of developing these blood clots. Testosterone restoration was also linked to prostate cancer in early 21st century studies. This was partially because testosterone therapy is associated with increased BPH levels in the bloodstream, which was once correlated with prostate cancer risk. New research has shown that while bioidentical testosterone does indeed elevate BPH levels, this does not have an impact on prostate cancer risk. Furthermore, a 5-year longitudinal study released in 2015 shows that recombinant testosterone therapy does not lead to increased incidence of prostate cancer. It is true that more research needs to be conducted in order to more fully assess the benefits and drawbacks of testosterone therapy for men over the age of 30 with testosterone deficiency. But that does not mean that you should avoid testosterone injections or other forms of treatment because of these unknowns. Men can benefit greatly with regard to energy, sexual health, psychological well-being, and fitness with the help of testosterone therapy. And you shouldn't be afraid to talk over the prospects of treatment with your doctor. Though testosterone can benefit patients with symptomatic low-T greatly, there is not yet sufficient evidence to encourage patients with no low-T symptoms to use testosterone deficiency as a protective measure, however. Perhaps one day, when we know more about how testosterone therapy low-T treatment can be used as a protective measure, and patients can start receiving appropriate treatment before symptoms appear. If you are interested in testosterone replacement or any other form of hormone replacement therapy, such as human growth hormone therapy or sermorelin injection therapy, we encourage you to reach out to a knowledgeable source, such as the Conscious Evolution Institute. Contact us at the number on our website to learn more. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.